Start with a mid-crestal ridge incision of about 2 cm distally to the planned implant position. Ideally, a band of keratinized mucosa of at least 2 mm should be present buccally and lingually or palatally to the incision. A vertical releasing incision may be placed at the distal end of the mid-crestal incision. The first osteotomy is made using saline irrigation with the pilot drill at around 600 rpm. Where the osteotomy dimensions allow, the implant should be placed 1 mm subcrestally. Therefore, a one size longer stoppered pilot drill should be used to prepare the deeper osteotomy. Prepare the osteotomy with repeated apical coronal movements rather than a single apical action to avoid excessive heat. The pilot drill can be used below 50 rpm and without cooling irrigation for low-density bones such as in posterior maxillary areas. I-reamers have a single sharp edge and should be preferred when deepening the osteotomy or selective bone removal is needed. I-reamers should not exceed 40 rpm to avoid overheating and do not require saline irrigation. L-reamers should be used for enlarging the osteotomy and work below 50 rpm without saline irrigation. Harvest the autogenous bone collected by the I-reamer and L-reamer's chamber during the drilling process. L-reamers and I-reamers should follow the consecutive width order until the desired implant diameter is achieved. Each product package has a label containing all necessary information about the implant such as its type, length, width and well. All I-system implants are packed in sterile packages containing the healing cap, plastic carrier, and the implant. The implant is carried into the osteotomy site either using the plastic carrier available in the implant package or the inserter and retriever tool presenting in the surgical kit. In the I-system surgical kit, two different handles are provided as straight and curved. For the anterior region, the straight handle should be preferred and the curved handle is available for the posterior region. The seating tip should be placed to the handle tip. During the implant insertion, a shaking and rotating movement may help to position the implant in place correctly. The seating tip is used to tap the implant gently. I-system implants should ideally be placed 1 mm subcrestally when sufficient hard tissue volume is present. Therefore, the depth of the osteotomy to the crest should exceed the length of the implant. If the implant is placed subcrestally, the black PEEK cover plug is inserted to seal the well. In this video, the autogenous graft collected with the drills from the osteotomy socket and the allograft were mixed and applied to the surgical field animatively. The prepared graft should be used to cover the implant's sloping shoulders to allow for optimum implant coverage and integration. When suturing, a tension-free flap should be achieved and total primary wound covering healing should be achieved for the best predictable and successful osseointegration.